everyone, I'm Ria, and welcome to another episode of Inside the Leader's Mind, a space where we have honest, easy conversation with the leaders who are shaping how we think, work, and innovate. Today, I'm really glad to be chatting with Ravinder Singh, who's leading the healthcare and life sciences service line at Tech Mahindra. Ravinder brings together healthcare, technology, and large-scale transformation, which makes this conversation especially relevant at a time when innovation is accelerating and responsibility matters more than ever. Ravinder, it's great to have you here. Thank you so much for taking our time for this conversation.
Well, thank you for having me. Excited about the episode today.
It's our pleasure. Ravinder, across the world, we are seeing governments introduce stricter regulations around the use of AI in healthcare. From your perspective, how should the industry balance innovation with the responsibility of ensuring patient safety?
So this is a very good question. First and the foremost, whether it is AI or not AI, healthcare by default is a heavily regulated industry, right from the education to how physicians practice, how the measurements are done in terms of outcomes. So it is a regulated industry. So the environment itself is highly regulated. Now, when we look at AI, think about any disruption that actually comes into a critical industry like healthcare, which plays with lives on an ongoing basis. There is a need to make sure that we are bringing all the innovation in the safe possible manner. Let's look at this, right? AI and digital allows us to scale across the board in a much faster manner. So think about a physical device that you would have introduced versus an algorithm that can actually be rolled out at one click, and the kind of impact it can make in a very short period of time. So that essentially, tells us while there's an opportunity, we just need to make sure that we kind of closely guard the impact that it makes on the ground. So the regulations are essential, and at the same time, as you rightly mentioned, there's a need to balance it out. The second dimension that I would also take here is that while we are good, as far as some of the other interactions that we do, so whether we are actually purchasing something, whether we are actually doing a banking transaction, we are okay with a little bit of an impersonal kind of a touch to it because we want to get things done quickly. Healthcare is not like that. Everybody who gets into healthcare or needs care would like to be treated empathetically, and that means you cannot lose the human touch in that particular case. It's a trust that kind of gets you into the hands of the physician. So look at from the impact that can be made in a short period of time. The second is the need of the patient to kind of be treated in a personalized and empathetic manner, right? And the third is that the advancements that are happening, they are taken in a manner that it is safe for the patients while it actually creates the impact. And finally, not to forget that the cybersecurity becomes a very essential part of it with regard to how and the kind of damage it can actually do. So thinking about all of this, there is essentially a need to make what I would call as human-centric AI, and that's the position that most of the regulators have also taken. So I'm all for these and also understand the environment in which we operate. The need for regulations is very relevant, and I think it is heading in that direction. Only thing is this needs to happen more quickly, a little bit faster, because the innovation is happening much faster than the pace at which the regulations are coming. So I believe some of the initiatives, which is collaboration with the academia, collaboration with the industry, and collaboration with the government, will make it actually happen faster. So I believe that's where we are headed. As an industry, we are headed in the right direction, but definitely need to accelerate more.
I really like how you frame that. Moving on, interoperability has been a long-standing challenge in healthcare. Do you feel we are finally close to solving it, or is it still more complex than we often acknowledge?
Interoperability has been a moving target for the industry. When we started with syntactic interoperability, that as long as I can exchange a message in the right syntax and the machines can process it. Then we started getting into semantics, right? And that's where the ontologies were born. So you start looking at SNOMEDs of the world and all that. Now the third phase that we are getting into is that we are now starting to think about how can you deal with more complex data, because data complexity has also grown. I mean, we started with the labs of the world, the ADTs of the world. Now what we are dealing with is genomic data sets, which is a very different formats. We are dealing with imaging data sets. We are dealing with 7 Tesla, 11 Tesla kind of machines, which are giving us a very different kind of an output. So if you look at from a target standpoint, it's a moving target. But I believe we are also starting to play a catch-up game, because with the whole emergence of large language models and generative AI, our ability to process unstructured data rather than going through the hoops of formatting, putting it into right semantics, that mapping, that actually will be, shortened significantly. So I believe, will we ever solve it? Maybe no, because I think we'll continue to innovate on the digital formats and digital data that is going to be produced going forward with all the advancements in medtech. But will we actually be able to catch up faster? I believe that is what will happen on the ground.
I think that's a very honest take and it's refreshing to hear that realism. Now the next section is quick and instinctive, just preferences. All right. Sure. Telemedicine or in-person care?
Depends. If I just need a prescription refill, telemedicine. But when my tooth aches, I better go to a doctor.
Right. Data privacy or data accessibility?
I'll prefer, data accessibility.
All right. Books or podcasts?
Books.
Songs or movies?
Songs.
Interesting choices. They say more than people realize. Now, first thing that comes to your mind, a travel destination.
I always love Thailand. I mean, just the hospitality and the kind of, variety of activities that you can do there. Thailand, I would say, followed by Andamans.
If not healthcare tech, which industry would you choose?
Okay, I changed my mind on this multiple times. I'm still confused. But if I were to choose today, I would possibly be doing something in the field of science. I was always attracted to physics and I would possibly be doing some research in physics.
Absolutely stunning. A book you're currently reading?
Okay, just started a few days back, Radical Candor.
Do you recommend that to everybody?
I would recommend everybody who's getting into leadership modes.
Okay, finally a healthcare innovation that excites you today.
Yeah, there are several actually. And while we always said that healthcare is a laggard, but the kind of innovation that we have seen is extremely, extremely high. I would say the protein folding algorithm that actually came out of DeepMind, that fascinates me. Not just because of the computational capability that is behind it, but I think the possibilities that it actually opens up for all the unmet needs that we have had as humanity. So that really fascinates me.
That's a great mix. It really gives us a glimpse into how you think beyond the role. It's the last question now, and this one's about the future. When you look ahead, what does a truly digital hospital look like to you? Not just in terms of technology, but how it actually feels for the patients, clinicians, and caregivers.
I think envisioning the future is always something which is exciting, and we can push our limits together. I'll tell you what it cannot be or should not be. It should not be a bunch of robots treating me. But I think the digital hospital will be something that actually gets me in front of a qualified physician, and the physician has enough tools that are actually helping her, and she spends more time with me, right? And then the third part of this is that I am actually a participant in the care that I take, because all of us are now very keen on knowing rather than saying, okay, we'll see what happens at the end. And then finally get better as quickly as you can. So I would say with that premises, I would say that it has to deal from three areas. So I would like an experience that, my appointment first and foremost is fixed as per my convenience with the right physician at the right time. So that's an important part, because a lot of times we actually miss appointment because it is not convenient to us. So how can I actually make that piece very, very frictionless? Number two, my arrival information is available. I should actually be directed to the parking once I'm there. So the check-in should start from there. I should immediately know where I'm actually landing, auto debit into the fees that is required for an outpatient standpoint. And then finally, get in front of the physician with all my history that is available. And the history should actually tell the physician very, very quickly in terms of why I'm here, what is required. My measurements are taken, while I'm actually getting in. And the physician actually asks me more about my health, understands the concerns, understands the experiences that I'm going through. And then finally is using, I would say, the latest of the research to give me a diagnosis. So that's what I would actually experience. At the same time, when I'm actually going out, I do not get and then say, here is a bunch of pills for you. What physician also tells me is that this is the lifestyle changes that you required. And by the way, I'm actually all for robots pushing me to make sure that the lifestyle adjustments that I have to do are actually done. So it's a combination of, I would say, very, very seamless experience that I will say. I'm getting the latest of the care, but in a very personalized manner. And then finally, there is a constant nudge, making sure that I adhere. That's the vision that I have.
Well, I think that's a powerful way to look at it, especially the emphasis on experience, not just systems. I think it really brings the future into focus. We are towards the end now. This has been a really insightful conversation, Ravinder. Thank you so much for sharing your perspectives and for making this such an engaging chat. I genuinely had a lot of fun with this one, and I'm sure our viewers will take away plenty of food for thought. Thank you once again for taking out time for this one. See you in the next episode of Inside the Leader's Mind. To everyone watching, because at Tech Game, we're always hashtag
We are always
limitless
limitless together.
together.
Yes.
Yes.
Thank you, Ria.
Thank you.